Best practices for streamlining cardiology medical record retrieval. When it comes to cardiology medical record retrieval for attorneys for legal use, there are several best practices to consider. These practices can help ensure that medical records obtained are accurate, complete, and suitable for legal purposes. Here are 20 tips. Engage a qualified medical record retrieval service. Consider partnering with a reputable medical record retrieval services that specializes in gathering medical records for legal cases. They can navigate the complexities of medical record retrieval, ensure compliance with privacy regulation, and provide the necessary expenses. Number 2, clearly define the scope and purpose. Clearly communicate the specific requirements and purpose of the medical record retrieval to the service provider. This includes identifying the relevant time period, specific medical conditions, treatments, procedures, and any other pertinent details. Number 3, obtain necessary authorization. Ensure that the attorney has appropriate authorization from the client or the court to request and access the medical records. The authorizations to comply with all relevant legal and privacy requirements such as HIPAA in the United States. Number 4, provide detailed instructions. Clearly communicate the required format, organization, and specific documents needed. For cardiology cases, this may include electrocardiographs, ECGs or EKGs, stress test results, operation reports, consultation notes, and more. Number 5, specify preferred delivery format. Inform the medical record retrieval service about the desired format the records, such as the electronic copies in PDF or TIFF format, or hard copies. Consider the convenience of digital formats for ease of sharing, storage, and searchability. Number 6, ensure compliance with privacy regulations. Confirm that the medical review company follows strict privacy protocols to protect the confidentiality of patient information. This includes secure storage, transmission, and disposal of records, as well as compliance with applicable data protection laws. Number 7, validate the authenticity of records. Request the retrieval service to provide information on how they authenticate and verify the medical records obtained. This may involve confirming the source, integrity, and accuracy of the records to support their admissibility in legal proceedings. Number 8, maintain a detailed record log. Keep a comprehensive record log of all medical record retrieval activities. This log should include dates, communications, and interactions with the retrieval service, documents requested, and any other relevant information for future reference. Number 9, review and analyze the records thoroughly. Carefully review the retrieved medical records for accuracy, completeness, and relevance to the case at hand. Seek expert medical opinions if necessary to interpret complex cardiology-related informed accurately. Number 10, ensure compliance with legal and procedural requirements. Familiarize yourself with the specific legal requirements, deadlines, and rules governing the use of medical records in your jurisdiction. Adhere to these requirements to ensure the records are properly used in legal proceedings. Number 11, identify key healthcare providers. Determine the healthcare providers involved in the cardiology treatment and care of the patient. This may include primary care physicians, cardiologists, hospitals, clinics, and any other relevant specialists. Gathering records for all relevant providers ensure a comprehensive view of the patient's medical history. Number 12, request all relevant documentation. Consider requesting all relevant documentation that may support the case. This can include medication records, prescription orders, and so on. Number 13, be aware of record retention policies. Different healthcare providers have varying policies regarding the retention of medical records. Ensure that records are requested within the appropriate time frame to avoid any potential loss of relevant information due to record purging. Number 14, consider obtaining imaging studies. Imaging studies, such as CT scans, MRIs, and so on, can provide valuable visual evidence. Work with a medical record retrieval service to obtain these images in DICOM format, along with accompanying radiology reports. Number 15. Collaborate with medical experts. Engage the services of medical experts, such as cardiologists or other specialists, to help review and interpret the retrieved medical records. These experts can provide insights, opinions, and expert testimony to support legal arguments in the case. Number 16. Maintain organized records. Once the medical records are obtained, ensure they are organized and indexed in a logical manner. Use appropriate document management software or systems to facilitate easy access and retrieval of specific records when needed. Number 17. Prepare a medical chronology or timeline. This can help attorneys and experts understand the sequence of events and identify any potential deviations from the standard of care. Number 18. Seek clarification and follow up. If certain records are incomplete, illegible, or require clarification, search out the healthcare provider or retrieval service to address these issues. Number 19. Consider deposition and witness preparation. As part of the legal process, depositions may be conducted with healthcare providers involved in the case. Prepare thoroughly by reviewing the medical records in detail, identifying inconsistencies or gaps, and formulating relevant questions to obtain valuable testimony. Adhere to legal ethical obligations. Ensure that all medical records obtained are used strictly for legal purposes and treated with confidentiality and discretion. Comply with legal and ethical obligations to safeguard potential privacy and protect sensitive medical information. Remember that these guidelines provide general recommendations and legal requirements, and practices can vary depending on your jurisdiction. Consult with your professional experience in medical record retrieval and healthcare law for specific guidance tailored to your needs. Thank you for listening. Have a good day.